Did you know that Medicare leaves significant gaps in coverage, leading many seniors to pay thousands of dollars of out-of-pocket costs every year? With upcoming changes in 2025, these gaps could become even more costly if you're not prepared. Stay tuned, because in this video, we're going to dive deep into the exact coverage gaps in Medicare, Medicare supplements, Plan G and N, Medicare Advantage plans, and reveal how to protect yourself with additional options that can save you unexpected costs and expenses. And if you're new here, my name is Kelby, Hightower with Medicare Hub. We're here to make your life easy by making Medicare simple. So make sure to hit the subscribe and click the notification bell to stay up to date on all things Medicare. Let's get started. So let's start with Original Medicare, which includes Part A, hospital insurance, and Part B, medical insurance. Original Medicare is great for covering essential medical needs, but still leaves substantial gaps. Part A in 2024 has a deductible of $1,632 each period. For 2025, we anticipate this number could increase again, meaning more out-of-pocket expenses for each hospital stay. Now, this isn't a one-time annual cost, it's a per benefit period cost. So if you're hospitalized more than once, you're paying that deductible each time you're hospitalized. After 60 days in the hospital, you also are responsible for daily co-insurance costs for extended stays, and that can add up quickly. With Part B, the 2024 deductible is around $240, and you're responsible for 20% of the outpatient care costs after that deductible is met. Again, this is without a cap, meaning your 20% can quickly grow if you need extensive treatment. In 2025, this deductible is expected to rise, so keep track of those changes. And so remember, Original Medicare doesn't cover dental, vision, hearing, or long-term care. These are common medical needs for seniors, leaving many with gaps in essential care and coverage. These are serious gaps that leave you exposed to the high out-of-pocket cost expense. So keep watching, because I'll show you the option you have to fill these gaps effectively. Next, let's look at the Medicare supplement plans, or Medigap, specifically Plan G and N, some of the most popular choices among seniors looking to cover additional expenses. So Plan G is one of the most comprehensive Medigap coverage options, covering nearly all the costs left by Original Medicare. The only thing it doesn't cover is the Part B deductible, which, as we mentioned earlier, is expected to rise from $240 in 2024 on up. After this deductible is met, you have 100% coverage of the Medicare approved cost. However, like Medicare, Plan G doesn't cover any routine dental, vision, or hearing services, nor does it cover long-term care or prescription drug coverage. You'll still need to separate policies to cover these areas. Plan N is very similar to Plan G, but comes with some small copays. You'll pay around $20 for a doctor visit, or up to a $50 copay for emergency room visits if you're not admitted. This can help save on monthly premiums, but leaves you with some out-of-pocket costs with each visit. Like Plan G, Plan N doesn't cover the routine dental, vision, or hearing, or long-term care. So now let's talk about Medicare Advantage plans, also known as Part C plans. These plans bundle the Part A, the Part B, and the Part D into one, and often include additional benefits like the dental, the vision, and the hearing. But Medicare Advantage plans have their own set of limitations as well. Copays and co-insurance, unlike Medigaps, which fill nearly all gaps, Medicare Advantage plans are going to have copays and some co-insurance for some services. For example, each doctor visit, outpatient surgery, or hospital stay may require a separate copay depending on your plan, and these costs can change every year. Network restrictions. So Medicare Advantage plans often have network restrictions, meaning you may pay more or even the full cost if you go out of network. This is important to consider if you travel or need specialized care outside of your local area. So out-of-pocket maximums. Medicare Advantage plans have an out-of-pocket maximum. Typically it ranges from $4,000 to $7,000 each year, and this amount may increase in 2025 and beyond. While it's helpful to have a cap, this is still a high cost for those that have a fixed income, and these maxes may vary by plan and region. So while Medicare Advantage plans have a unique benefits and coverage, they come with limitations that can leave you paying more if you're not fully informed. So let's talk about ancillary products and how they can fill in the gaps, providing a safety net for all out-of-pocket expenses that Medicare or Medigap doesn't cover, like dental, vision, and hearing. These products can save you significantly, especially as routine dental, vision, and hearing costs aren't covered by Medicare or Medigap. These policies typically have affordable premiums and cover preventative care that can add up over time, but hospital indemnity plans, these plans pay a lump sum if you have been hospitalized, which can help offset the high deductibles and coinsurance costs for both Medicare and Medicare Advantage. Cancer, heart attack, and stroke policies, a single diagnosis of a major illness can lead to a substantial medical bill. These policies provide additional payouts that help cover coinsurance, copay, and deductibles, particularly in Medicare Advantage plans. So what about long-term care insurance? Long-term care is one of the biggest gaps in Medicare coverage. A long-term care policy can protect you from the financial risk if you require extended care, which isn't covered by Medicare or Medigap. By using ancillary products strategically, you can build a more complete coverage plan that protects you from high cost and gives you the real peace of mind that you desire. To wrap things up, understanding Medigaps and Medicare coverage is essential to making an informed decision about your health care. As healthcare costs rise in 2024 and 2025, you need to know what you're paying for and what's left to you, whether it's original Medicare, Medigap, or Medicare Advantage. Every plan type has gaps. By adding ancillary products, you can safeguard yourself against those hidden costs and get the most comprehensive coverage. If this video helped you, don't forget to like, subscribe, and hit the bell icon. Leave a comment below, share it with a friend. You may be confused about Medicare, they may be confused about Medicare, and sharing this information may help them along their journey and making their life easy by making Medicare simple. Guys, click below to be a part of one of our Medicare Made Simple workshops or to schedule an appointment today.